Welcome to our channel. Today, we're going to discuss medullary thyroid cancer, a less common but important type of thyroid cancer. Medullary thyroid cancer, often abbreviated to MTC, originates from the parafollicular C cells of the thyroid gland, which produce calcitonin, a hormone involved in calcium regulation in the body. Unlike the more common forms of thyroid cancer, such as papillary and follicular thyroid carcinoma, MTC has distinct characteristics that are crucial to understand. MTC accounts for about 3 to 5% of all thyroid cancer cases. It can occur sporadically or as part of a hereditary syndrome known as multiple endocrine neoplasia type 2, or MEN2. MEN2 is further divided into type 2A and type 2B, both of which significantly increase the risk of developing MTC, along with other endocrine tumors. If someone has a family history of MTC or MEN2, genetic testing is often recommended, as early detection can be life-saving. Symptoms of medullary thyroid cancer can often be subtle and may overlap with symptoms of other conditions. Patients might experience a noticeable lump or nodule in the neck, hoarseness, difficulty swallowing, or some neck pain. In cases where the cancer has advanced, patients may also experience flushing of the skin, diarrhea, or symptoms related to increased levels of calcitonin or other hormones. Diagnosis typically involves a combination of imaging studies and blood tests. A neck ultrasound may be performed to visualize any thyroid nodules, followed by a fine needle aspiration biopsy to determine whether the nodule is malignant. Blood tests are crucial for measuring levels of calcitonin and carcinoembryonic antigen, or C, which can be elevated in MTC. Once diagnosed, the primary treatment for medullary thyroid cancer is surgical removal of the thyroid gland, known as a total thyroidectomy. This surgery aims to eliminate cancerous cells and prevent the disease from spreading. In patients with hereditary MTC, proactive surgeries may be advisable even before symptoms appear. This approach often involves genetic counseling to help patients understand their risks and the implications of having familial MTC. While surgery is the main treatment, it is important to note that MTC can vary in its aggressiveness. Some patients may experience only slow growth, while others may develop more aggressive disease. In advanced stages, where surgery is no longer a viable option, targeted therapies and clinical trials may provide alternative treatment pathways. Drugs such as vandetanib and cabozantinib have been designed to target specific pathways involved in cancer growth. Surveillance after treatment is critical. Ongoing monitoring through regular blood tests for calcitonin and imaging studies helps track the recurrence of cancer. An elevated level of calcitonin may indicate the presence of residual or recurrent disease. Living with medullary thyroid cancer can be challenging, not only physically but emotionally as well. Support groups and counseling can provide valuable resources for patients and their families. Education about the disease is also vital, empowering patients to make informed decisions regarding their care and any long-term management plans. In conclusion, medullary thyroid cancer is a complex condition with distinct characteristics and treatment considerations. Early diagnosis is crucial, especially for those with a genetic predisposition. Through education, awareness, and ongoing research, we hope to improve outcomes for those affected by this disease. Thanks for watching. If you found this video informative, please like, share, and subscribe for more content about thyroid health and other medical topics.